but there are adverse events from the vaccine. It does cause deaths.
Let's get vaccines straight. What's up, everybody? Welcome back to the Easy Conversation. And today we're going to be talking about vaccines, in particular, the measles MMR vaccine. Serious adverse events from vaccines, including death in the US, are extremely rare. As of March 2025, the Vaccine Adverse Events Reporting System, also known as VAERS, most recent data indicates that death following vaccines remain exceedingly rare. Established in 1990, VAERS was designed as an early national warning signal to detect any possible safety problems within any U.S. vaccine licenses. VAERS is also co-managed by the CDC and the U.S. Food and Drug Administration. The measles, mumps, and rubella vaccine, the MMR, has been studied widely for safety and effectiveness. According to the CDC and WHO, deaths related directly to the vaccine are extremely rare. So rare, it is difficult to quantify. But look, check this out. In a study from the NIH, the National Institute of Health, entitled Adverse Events Associated with Childhood Vaccines, Evidence Bearing on Causality, states that in order to answer the question, can any deaths be attributed to the use of the MMR, had to be broken down into 7 categories. This is number 1, and as follows. Deaths for which the available data were insufficient to allow a judgment of cause. This means that there was not enough information such as medical records, autopsy results, clinical history to point to the vaccines being the actual cause of death. 2. Deaths associated with vaccine administration but attributed to inappropriate handling, contamination, production error, or error of medical care. The deaths that are being referred to in option 2 occurred after the vaccine administration, but it was not caused by the vaccine itself. To be even more detailed, the issue arises within human error or system failures. 3. Deaths temporarily associated with the vaccine administration but clearly caused by something other than the vaccine. This means that the deaths occurred around the same time the vaccine was administered. However, there is no clear evidence that the vaccine was the cause. There may have been other identifiable factors such as underlying medical conditions or any unrelated illnesses. 4. Deaths classified as sudden infant death syndrome, also known as SIDS. SIDS is when the death of a healthy seeming and unexpected child dies, and this typically happens in their sleep and under the age of 1. And even when investigations have been put into place, there is still no clear cause that the vaccine caused the infant's death. Deaths that are a consequence of vaccine strain viral infection. These deaths refer to or were caused by an infection from a weakened attenuated virus strain used in certain live vaccines. Live attenuated vaccines contain a weakened form of the virus that is designed to stimulate an immune response without causing disease in healthy individuals. However, in rare cases, probably in people with severely weakened immune systems, the weakened virus can still replicate and cause illness. 6. Deaths that are a consequence of an adverse event that itself is causally related to a vaccine reviewed in this report. This means that there is evidence linking the vaccine to a specific adverse reaction, and that reaction ultimately led to the death. And 7, which is deaths that are temporarily associated with vaccine administration, but not the other options that have been listed. The CDC and FDA emphasize that while VAERS accepts all reports without verifying causation, thorough investigations have consistently shown that vaccines are overwhelmingly safe, with serious adverse events, including death, occurring at a rate of fewer than 1 per million doses administered. To close, in the year of 2024, from January 1st to December 31st, there have been a total of 285 confirmed cases of the measles. In the turn of this year, 3 months into 2025, there have been a total of 280 cases and rapidly growing. The recent cases that we have been seeing on the news have all been cases of unvaccinated individuals. The danger is that all unvaccinated individuals run a high probability of contracting measles and will even display health complications that could lead to death. Again, y'all, stay safe, stay healthy, stay loved.